Welcome to You're in Good Hands, the podcast where we dive into everything urology, leading-edge treatments, education on a variety of topics, and expert insights to keep you informed and healthy. Brought to you by the Advanced Urology Institute of Georgia, where innovation meets compassionate care. Because when it comes to your health, you're always in good hands. As always, the information discussed today is purely informative and does not constitute medical advice.
Welcome to the Deep Dive, your ultimate shortcut to being truly well-informed. We dig into complex topics, pull out the key takeaways, and, well, try to make it interesting, maybe even a little fun. And today we're tackling something really timely. It's June 2025, which, is Men's Health Month, so our focus is men's health, and we're going to put a special lens on urologic well-being. Now, for this deep dive, we're working with some excellent comprehensive material provided directly by Advanced Urology of Georgia. Our mission today, it's pretty clear. We want to equip you, our listener, with the vital knowledge about common health challenges men face. Things like how to stay proactive and, honestly, why catching things early isn't just nice. It's a total game changer.
That's spot on. It's not just about a checklist of what to do. We really want you to grasp the why these things matter for, your long-term health, your energy, your quality of life down the road. That's the real value here.
Okay, so let's unpack men's health. The material makes it super clear it's way more than just treating illness when it pops up. It's about supporting the whole picture: physical, emotional, sexual well-being, all of it. And here's a pretty stark insight from the sources. Men tend to wait much longer than women to see a doctor, even for the same symptoms. This isn't just a small delay. It often means easily managed things can become chronic, sometimes really life-altering, affecting health, work, relationships. So, okay, early detection. Why does it matter so much?
It matters because it genuinely saves lives. That's not an exaggeration. And it leads to much, much better outcomes. Think about it catching something small, maybe before you even feel major symptoms. That usually means less invasive treatment, faster recovery, way higher chance of putting it behind you completely. Being proactive, it's not just a buzzword. It really is the best strategy for staying healthy, staying active as you age. And that's why Men's Health Month in June is so highlighted in the material. It's that focused time for awareness, for prevention, getting those screenings done. You might see the blue ribbon around. That's the symbol. It's a reminder that looking after your health, well, that's a sign of strength, not weakness.
Yeah, reframing strength like that is incredibly important. Okay, so as men get older, different health issues tend to crop up more often. The sources lay out the big ones: heart disease, high blood pressure, diabetes, prostate conditions, um, sexual stuff like erectile dysfunction, and also, really importantly, mental health, depression, anxiety. Knowing your risk, getting those regular checkups. It seems absolutely fundamental. It's not just managing symptoms. It's about trying to head off future problems, right?
Exactly. And the foundation for managing all of that really comes down to lifestyle and diet. The material consistently points to the power of whole foods, lots of fruits, vegetables, lean proteins, and combining that with regular exercise, consistent movement. Plus, the non-negotiables. Definitely avoid tobacco and limit alcohol intake. But there are a couple other things, often overlooked but just as critical. Getting enough good quality sleep and managing stress effectively. Stress, particularly chronic stress, has this pretty profound impact on heart health, hormone levels, mental well-being. It contributes to things we sometimes just blame on getting older.
Right. Stress is a sneaky one. Okay, we've talked lifestyle. Let's get practical. What about the specific actionable steps, those key health screenings every man should be thinking about, starting with the basics?
Yeah, the absolute basics, the foundations, regular checks for blood pressure, cholesterol, and blood sugar. Everyone needs to keep an eye on those. Then, as you get into your 40s, maybe 50s, age-specific screenings become really vital. The sources strongly recommend talking to your doctor about colon cancer screening and also prostate cancer screening. That typically involves a PSA blood test, prostate-specific antigen, and a physical prostate exam, usually starting around age 45 or 50.
Okay, 45 or 50.
But, and this is important, maybe even earlier if you have a family history of these cancers. That changes the timeline. And another thing, especially important for younger men, but relevant for all, monthly testicular self-exams. It sounds simple, but it's incredibly effective for catching testicular cancer early when it's highly curable.
That's a really practical tip.
One more thing, if you're feeling persistently tired, low energy, maybe noticing lower libido, or even losing muscle mass, it's worth checking your testosterone levels. A simple blood test can tell you if that's playing a role.
Okay, that gives us a really good grounding in overall men's health. Now, let's really dive into an area the material emphasizes, especially as men age: urologic health. So we're talking bladder, kidneys, the prostate, and sexual function. The stats show these issues get way more common as guys get older, but unfortunately, a lot of men kind of put off getting help, suffer in silence, maybe?
They absolutely do. And that delay, it just lets things get worse, leads to unnecessary discomfort, and sometimes turns simple problems into more complex ones. But here's the really encouraging part. The vast majority of these urologic issues, they are highly manageable. Many are even curable. Getting diagnosed early and starting treatment makes a huge difference to comfort, confidence, and, long-term health. So understanding this stuff is incredibly valuable.
Right. Let's zoom in then. One of the most common things affecting, most men over 50, benign prostatic hyperplasia BPH, the enlarged prostate. For listeners out there, what are the typical signs? What does the material say you might experience?
Yeah, BPH symptoms are usually pretty distinct. Things like a slow or weak urine stream, maybe having to get up multiple times during the night to pee, or that sudden urgent feeling like you have to go right now, or sometimes this feeling like you can't quite empty your bladder completely.
Those sound disruptive.
They really can be. They impact sleep, travel, confidence, just daily life. But the good news with BPH is the range of effective treatments. It goes beyond just pills. There are lifestyle changes, yes, medications too, but also some really advanced, minimally invasive procedures, things like urolift or RISM. These can provide significant, lasting relief from symptoms, really improve quality of life. It's definitely not something you just have to live with.
That's good to know. Okay, sticking with the prostate for a moment, let's talk prostate cancer awareness. The material flags this as the second most common cancer in men. But crucially, it's highly treatable if you catch it early. The tricky part, though, is that it often has no symptoms in those early stages. Makes detection harder, right?
Exactly. That lack of early symptoms is precisely why screening is so important. It's the key. The standard screening methods are that PSA blood test we mentioned and a physical prostate exam. Again, for most men, the conversation starts around age 45 to 50,
Or earlier with family history.
or earlier with family history, correct. It's actually kind of fascinating how relatively simple these screening tests are, considering the massive impact they can have on catching cancer early and improving survival rates.
Yeah, simple tests, huge potential impact. Okay, moving on. Let's talk about erectile dysfunction, or ED. Sometimes people just think of it in terms of intimacy, but the sources point out something really important. ED can actually be an early warning sign, like your body sending a message about other underlying health issues.
That's a critical point, often missed. ED can absolutely be a sign of poor circulation, maybe underlying cardiovascular disease. Sometimes it shows up years before any heart symptoms.
Wow, years?
It can be, yeah. So while ED is very common, especially over 50, the really good news is that it's also very treatable. And the options are broad. Everything from oral medications to injections, even advanced procedures like penile implants in some cases. The key is tailoring the treatment, finding what works for the individual, and importantly, looking for and addressing any underlying health stuff that might be contributing. It needs a comprehensive look.
Right, treating the cause, not just the symptom. Okay, another area, sometimes guys experience things like ongoing fatigue, maybe mood changes, trouble focusing, not just feeling off. Could this point towards low testosterone or low T? The symptoms seem quite varied: fatigue, low libido, poor focus, mood shifts, even losing muscle mass.
Absolutely. Those symptoms can really drain you, impact your daily life significantly.
Right.
If you're feeling that kind of persistent sluggishness, irritability, maybe your concentration is shot, or you've noticed a real drop in drive or physical strength, low T is definitely something to consider. And finding out is straightforward, just a blood test. If low T is the issue, treatments like testosterone replacement therapy can make a world of difference. Restore balance, bring back energy, focus, vitality. It can be quite transformative.
Good to know it's often simple to diagnose and treat. Okay, finally, in this urologic section, let's touch on general urinary symptoms and bladder health. Things like having to pee really frequently, always feeling that urgency, or different kinds of incontinence like overactive bladder or maybe post-void dribbling. These aren't just small annoyances, are they?
Not at all. They can seriously disrupt your life, impact work, social plans, sleep, everything. And it's crucial to know these aren't just, an inevitable part of getting older that you have to put up with. These symptoms could stem from various things. Maybe an overactive bladder, could be weakened pelvic muscles, or like we discussed, an enlarged prostate. But the positive message is there's a whole spectrum of solutions. It might start with diet changes or specific exercises. It could involve medication, or even various outpatient procedures, the goal is always tailored. Improve control, increase comfort, and basically give you back your quality of life.
Okay, so we've covered common challenges and really dug into urologic health. Let's widen the lens again now to the overall treatment approaches. The material highlights quite a range. Medications, these minimally invasive procedures you mentioned, sometimes surgery. And the key theme seems to be personalization.
Personalization is absolutely paramount. Every man's situation is unique to specific symptoms, overall health, what his goals are for treatment. And it's worth stressing again that many of these advanced treatments, they're available right in specialized clinics or outpatient centers, often using the latest cutting-edge technology. So connecting it back to the bigger picture, it's not about finding a solution, it's about finding the right solution for you. Modern medicine offers really tailored, effective options now.
And once a plan is in place, follow-up seems key. The material mentions monitoring, check-ins.
Definitely. Consistent follow-up is crucial for the best results. That might involve lab tests periodically, maybe some imaging, regular check-ins with the healthcare team. It allows for adjustments if needed. It's really an ongoing partnership focused on your long-term health.
A partnership, I like that.
Yeah. And really, that brings us full circle to the main takeaway we hope listeners get today. You really do have the power to take charge of your health. Don't hesitate. Ask questions. Stay informed. And most importantly, take that first step. Take action. Which I guess raises a question for everyone listening. What's maybe holding you back, or what small step can you take?
And that's a perfect tie-in, because Men's Health Month, right now, June 2025, it's like the designated nudge, right? The perfect time to schedule that checkup maybe you've been delaying. Talk about any concerns, big or small. Just make that investment in your long-term well-being. The material consistently says, help is there. We are here to help every step of the way. Okay, so this deep dive, drawing from that expert material provided by Advanced Urology of Georgia, hopefully armed you with some crucial insights. Proactive health, early detection, the whole picture of men's well-being. You can learn more or make an appointment if you feel ready by calling 678-344-8900. That's 678-344-8900. That's 678-344-8900. Or visit our website, www.advancedurology.com. All right, as we wrap up, here's something to think about. What one small, doable step will you take this month to invest in your own long-term health and well-being?
If you happen to be in Georgia, you can always check out Advanced Urology Institute of Georgia. They've got 10 convenient locations throughout Metro Atlanta. You can make an appointment by calling 678-344-8900 or go online to www.advancedurology.com.
Great advice.